Hello, everybody, and welcome to our TIF Talk. I'm Andrea Millers with Endogastric Solutions, and thank you so much for joining us tonight. With me today, I've got Wendy Profit with our Endogastric Solutions team. So thank you, Wendy, for being here with me tonight. I am super excited about this show. As you may or may not know, we've been talking about GERD Awareness Week, and ironically, GERD Awareness Week falls on Thanksgiving week when we all like to indulge in good food and drinks. So it is our mission at Endogastric Solutions to, do our best to spread the word about what is GERD, educate you guys, and let you know that there's some options out there. So today, we had a special campaign going in regards to GERD awareness. We was our GERD Gourmet cookbook. So I have it in hand today. We do also have it electronically, and I can't thank everybody enough for submitting your recipes. There are some really great ones in there, so I can't wait to share this with everybody today. We will also be announcing the 3 top winners of our campaign. So please stay on and keep watching so you can see if you were a winner. But today on our show, we have a lot of special guests. The first one we'll be introducing is Dr. Michael Murray. He's been here before, so we'll be chatting with him. We will also be showing you some of the recipes that we received from you guys and then announcing the winners. We will be also talking to a nutritionist, and so we'll be introducing her in a little bit. And we also have 2 very special patients that I can't wait for you to talk to. One of them you've probably heard from, Dylan Grove, and another one, Kristen Matson. So they'll be joining us later in the program. And we were lucky enough to meet with the president of IFFGD, Cecile Rooker, and you'll get to hear from her as well. I'll be giving away some stuff today too. We have a GERD Gourmet apron. So please, right now, if you don't mind, type where you're watching from, and we'll pick a couple of winners to receive that apron and also a cookbook. So without further ado, I'd like to introduce our first guest, Dr. Michael Murray. He is a board-certified general surgeon in kind of Sparks, Nevada area. He is a general surgeon and the director of Heartburn and Reflux Center at the Northern Nevada Medical Center in Sparks, Nevada. Dr. Murray specializes in general surgery, breast surgery, and gastrointestinal and endoscopic surgery. He is a fellow of the American College of Surgeons and an early trailblazer performing the laparoscopic hiatal hernia repair concomitant with the TIF procedure. So Dr. Murray, welcome, and thank you so much for joining us today.
Thank you for having me, Andrea. Good to be here.
Yes. So, we're going to start like we normally do and just kind of ask you, what is GERD? So maybe just explain that first, and then we'll kind of get into how nutrition and everything kind of falls into play with everything.
GERD is a little bit different than just acid indigestion. Most people have some idea what acid indigestion is. If you overindulge, as we may this week at Thanksgiving, you may get a bout of acid indigestion, but that's not necessarily a disease. And what makes it a disease is basically the frequency with which it happens. So gastroesophageal reflux disease is when this is happening 4 or 5 times a week, which is completely abnormal. And sometimes it'll happen when you're not eating or when you're laying down. So as a disease, it's something that becomes chronic, and it's often treated as a chronic disease. As a surgeon, we look at it as maybe it's partly anatomical as opposed to just a chronic disease that needs medication.
Right. So, one of the first lines of treatment, if you will, for GERD is kind of diet and lifestyle modifications. And what perfect time to talk about that during GERD Awareness Week, Thanksgiving. Talk a little bit about the importance of, the acid in your stomach and why PPIs. Let's talk about that and the food that you eat. maybe go into that a
So
little
let's just
bit.
start off. Why is there acid in the stomach in the first place? I mean, every vertebrate animal, anything with a spinal cord, has acid in the stomach. And so why is that? And the main reason is for digestion of proteins. Proteins really need to be digested in an acid environment. The enzymes that break down these proteins work best in an acid environment. The acid itself starts to unfold proteins so that these enzymes can start to break up the chemical bonds and turn it into little amino acids that your body can then use for whatever it needs, whether it's to build muscle, to fix things that are falling apart on you a little bit, or even to make new enzyme systems. So it's very important in that regard. The disease itself, gastroesophageal reflux disease, is when that acid gets up into the esophagus. Now, that's a different organ. So the stomach is designed to create this acid environment. There's a valve that prevents that acid from going up into the esophagus. So the disease is basically when that valve mechanism breaks down. It's really multifactorial why that would happen. It could be from hiatal hernias. It could be from too many lower esophageal sphincter relaxations. It could be partly due to gastroparesis or all these other events. It's a very complex mechanism. When too much acid gets into the esophagus lining is very similar to your skin. It's a squamous lining. So as you can imagine, if you put acid on your skin, it would create an ulcer. It does the same thing in the esophagus. So that's the disease. You have gastroesophageal reflux disease. The acid's getting up there. But it's not because there's too much acid generally. Acid's supposed to be in your stomach. Now, how we treat that is different if you're a medical doctor or you first go to a family doctor. Even if you just watch TV, you'll see commercials for these very strong medications called PPIs or proton pump inhibitors. And what these do is just basically stop the production of acid. They're very strong. And what that does is not prevent reflux. If you're getting reflux, there's other things in the stomach that can get up into the esophagus that can irritate it, such as the enzyme pepsin or bile or bacteria or other things. So it doesn't stop reflux. It just stops the acid component, which most people experience as that burning pain. And that's what they want to get rid of. So often they think, well, wow, this is great. Pain went away. I'm cured. And they just continue on the same pathway, same behaviors that produce the reflux. So a lot of times the disease can progress, even though you don't know that it's progressing because you're on these medications. So that's kind of why nowadays you see a lot of people with really big hiatal hernias and things like that. The disease has progressed. And so PPIs are, they are a significant component for treating reflux. Most people start out there. Like I said, you can get them over the counter, you can treat yourself. But at some point when you start to do dose escalation, they're not working, it's time to seek attention and get worked up for what's going on.
Right. Perfect. Thank you. And you talk a little bit about the diagnostic testing that you have patients go through to determine if they do have GERD and if this procedure would be appropriate for them.
So diagnostic testing for reflux has really come along in the last 10 years. I see a lot of patients that end up going to see a doc that'll do an upper endoscopy, and that's all they do, and they throw them on more pills, and it's like this perpetual circle. They never seem to get better. They go for an endoscopy, they get on pills, and they never get advanced to any other options. So the real workup for GERD for me is, and it's one of the most common things I do, is an upper endoscopy, Bravo pH study, where I implant a little chip in your esophagus that I'll record all the pH events, all the acid refluxes that occur over 48 hours. And also this newer technique called FLIP, which will help me understand the motility in your esophagus. So we can get all that data in one setting, one anesthetic. There's no sense in, putting you to sleep and getting only a microcosm of what's happening. I can take a look. I'll see how big your hiatal hernia is. I'll get the biopsies. Then I'll go on to do pH testing, which is 48 hours, right? That thing stays in. It lets me know what's happening over 48 hours. Then I'll also do a motility study. And that's a lot of information to get at one time. And so there's a lot of value in doing all three of those at once.
Yeah, perfect. And then can you explain what the TIF procedure is to everyone watching?
So a TIF is an endoscopic type of fundoplication. And really what we used to do, or what we still do in some cases, is when you look at what's going on with the reflux barrier, there's basically two things you can fix. You can fix the hiatus, which is important. That's the two slips of muscle that go around the esophagus and act as an external sphincter. You have to do something to fix the valve mechanism. There is a valve mechanism called the hill flap, or just a flap mechanism, that as you increase pressure in the stomach will close off the stomach so that that pressure doesn't push the contents into the esophagus. And so you can fix that by doing a fundoplication. The older ones were known as the Nissen or a toupee. They were extra physiologic. They tend to cause issues like dysphagia or trouble swallowing, and also gas bloat syndrome, trouble getting the gas out of your stomach. So TIF is a much more minimally invasive approach. It addresses that flap valve mechanism very nicely. It does not devascularize the stomach. It does not take the fundus away. The fundus of your stomach is there for a reason. It's not for surgeons just to make fundoplications with. It handles the gas that gets in your stomach, and it communicates with the esophagus to release that gas. So it's a very important area of the stomach. So TIF is minimally invasive. It goes through the mouth. It does not need incisions, any further incisions. It addresses the main problem at the area of the angle of His and that flap valve mechanism. It does so in a very minimally invasive and safe fashion. So the serious adverse event ratio is far less with a TIF than it is with a Nissen fundoplication. Side effects are less, especially the ones that we're really concerned about, like trouble swallowing and trouble with gas bloat syndrome.
Yeah, fantastic. Thank you. We do have a couple of questions, and then we're going to keep moving on to the program. I know we're going to talk later. If you are watching and you have some questions for Dr. Murray, please feel free to type them in, and we'll have him back on later in the program to answer all the questions. But we do have two that have come in, so I'm going to pass it over to Wendy to go ahead and ask those questions.
Thanks, Andrea. Dr. Murray, thanks so much for being with us tonight. A couple of questions just around this week in particular. One being, what foods should I avoid on Thursday to prevent some GERD flares? And then also, what type of exercises do you recommend folks either do or avoid when it comes to exacerbating that GERD?
So in terms of, especially this weekend, what makes reflux happen is the gradual breakdown of these, of the flap valve and of the phrenoesophageal ligament that holds things in places. And that's from overfilling the stomach, and that's all what we're going to do. So there's a certain amount that's just volume related. So if you could decrease the volume or spread that volume over a longer time frame, that would be better than trying to sit down and try and stuff everything in your face in an hour to get back to the football game. If you can make it a 6-hour thing, that would be a lot better for you. Alcohol is one of the things that really, I find, really gives people a lot of trouble with reflux. And even after TIF, I talk to people about, you have to watch the alcohol. Alcohol is known to cause reflux. It relaxes that lower esophageal sphincter. And other than that, it's usually these fatty meals, or maybe a charcuterie board, things that have a lot of nitrates in them that can get things going. So I'd watch those type of things. Certain people have other triggers, and you just have to watch those, classic or the acid type things like citrus fruits and things like that. In terms of exercise, I'm a big fan of it. What you have to watch out if you really have bad GERD is anything where you're bending over and lifting something. That would cause the reflux. But in terms of just exercise, any kind of walking, running, biking, anything where you're upright is going to be fine. It's things where you really have to increase your intra-abdominal pressure and you're bent over. So anything like that, I stay away from that.
Yeah, my husband likes to say his favorite exercise on Thanksgiving Day is getting up from the table and going to the couch to lay down flat and watch football. So I'm going to guess that's not on your list of recommendations.
Good idea to lay flat after a big meal, but we all do that. Everyone loosens up the belt afterwards, so I get it. You have to live your life too. I mean, it's GERD's a disease. Sometimes you're going to pay the price, and there's times when it's worth it. So.
Thank you very much. All right, Andrea, back to you.
Fantastic. Thank you so much, Dr. Murray. And we will get to more of your questions later in the show. But before that, I do want to announce our first recipe. The team got together at local here in our kitchen. So I'm going to pass it over to so you can see who the announcement is for the first recipe submission. Hang tight. Hey everyone, we are here in Austin in our GERD Help Kitchen. We're so excited. We have the whole team here today. We're excited to announce our winners for the recipe selections for our first ever GERD-friendly cookbook, GERD Gourmet. So we're gonna kick it off with our first recipe submission or selection / winner with Salome and Wendy.
Thanks everybody, we're excited to be here. Want to send special appreciation to Denivis Rodriguez from Torrance, California. She has submitted her green bean casserole recipe just in time for the holidays. We're going to go ahead and start with 2 cups of frozen green beans. You can partially thaw those or even use canned green beans. Also, we have a can of reduced fat cream of mushroom soup. We have 1 cup of water. We also have 1.5 cups of diced chicken or diced turkey. We have 1/2 to a cup of crumbled cornbread. Then we also have 1/4 cup of non-fat sour cream. We have 1/4 cup of low-fat cheddar cheese, 1/4 teaspoon of turmeric, and also some black pepper mixed in, 1/4 teaspoon. Some of the tools that you're gonna need today are gonna be a standard casserole dish. You'll need some measuring cups, also your measuring spoons. Serving size for this recipe is gonna be for 4 folks. Salome, go ahead and make it.
And for the sake of time, we've already, like I said, measured everything out. We have everything ready. So what I'll do is I'll start putting everything together in order. So here we have the green beans. So as I'm mixing together, I've got in the cream of mushroom soup along with the green beans. And so I'm gonna stir everything together real quick. And then what I'm gonna add next is either the diced turkey or chicken.
We're gonna heat this,
Yeah,
right?
so yeah, I want to heat the oven to 350. We've already got that done. All right, so from there we're going to mix all the ingredients. So I'm going to get the sour cream next. I think I got it all. I am no Pauladine. Sorry guys.
And so this is a great recipe in that it's flexible. You can heat these ingredients over the stove first to get everything nice and incorporated, or you can mix it this way, get it straight into the oven, just depending on the amount of time that you've got. What I will say is Denivis recommends that you heat these first ingredients on the stove for about 13 to 15 minutes. And that way it will get everything incorporated. You can then go ahead, put in the cheese, and make sure that it's melted for a few minutes, and then we'll go ahead and transfer everything into the casserole dish.
I'm just going to sprinkle this over there, make it look nice and pretty. And so normally, like for sake of time, we already did this and we've already put something together. As you can see, this is the end result and it's beautiful.
All right, giving it a taste.
It looks wonderful.
I love the cornbread idea. That is awesome. Never would have thought of that.
Yeah.
Oh, fantastic. Win. Thanks, Denivis.
Well, congratulations, Danny. We're so excited, and I'm so glad that you won the recipe submission. This is the book right here. You will be getting your gift card for HelloFresh, and also a cookbook. So look for that. We'll be reaching out to you. Next up, I'm very excited for our special guest. I don't think we've ever had a nutritionist or dietitian on the show yet, so this is our first time. We have Vicki Taylor here with us today. She is a registered and licensed dietitian nutritionist with the Academy of Nutrition and Dietetics, and has 37 years of experience in her field. She is currently the clinical nutrition manager at HCA Stonecrest Medical Center in Smyrna, Tennessee. And she's been working with patients undergoing the TIF procedure for over 2 years now. So Vicki, thank you so much for joining us today and welcome.
Thank you, Andrea. Thank you for having me.
Of course. So let's just get into it. How does nutrition relate to GERD?
Dr. Murray covered the subject really well and about reflux. What we eat, how we eat, and the timing of what we eat has a lot to do with the acid reflux as well. Basic key nutrition points would be to avoid foods and beverages that can increase the stomach acid production to begin with. We also want to minimize and try to avoid foods that are known to delay gastric emptying. We also want to avoid overeating at mealtime because that will increase the gastric pressure against the esophageal sphincter. And that's going to be a hard pill to swallow come Thursday when we all want to enjoy all those foods. And then big thing is to avoid eating so closely to bedtime that we suffer in that process.
Right. So I actually have a personal question. You know, you get to that point and you just can't stop yourself sometime. And I know, to your point, Thanksgiving, it's going to get there. Everyone's going to overeat. Everyone's going to drink. What can they do if they're there? They didn't stop from overeating. They've been drinking, and now they're just like laying in bed in so much pain. I heard, walking after a meal helps, or exercising. What are some things that they can do? Do they double dose on their PPIs? What would you I mean, I don't know. What do you recommend?
I recommend getting up and just walking. Let gravity help. Pull it all down. That will probably give them the most relief. Milk can sometimes help, but it would have to be a low-fat milk because fat in and of itself would produce some issues too.
Right. Perfect. Okay. Another question. Can GERD cause nutritional deficiencies?
GERD itself does not cause nutritional deficiencies, but what we find is that people suffering with GERD will frequently not take in the nutrients that they need to simply because of the discomfort that they have in the process of eating. So they're declining in oral intake, so that will produce less calories taken in, so they'll lose weight, maybe even lose muscle mass because they're not eating enough protein. They're seeking relief, so they're cutting back on the food intake. Over a prolonged period of time, of course, other nutrient deficiencies could occur. Taking multivitamins might be an option to fill in those gaps. However, that's a mixed bag. A multivitamin that contains calcium, zinc, and iron, those have been known to aggravate GERD symptoms as well. A multivitamin with vitamin A, C, and D, those are wonderful antioxidants, and they've been known to be helpful for GERD symptoms. So my recommendation is just checking with your primary care physician and healthcare professional to see what their recommendation would be for supplementation. There have been some studies to show that there's an association between heartburn medications and the development of a vitamin B12 deficiency. Those medications can block and suppress acid production, but they also can block B12 absorption.
Okay. Thank you. A lot of patients are always looking for that one stop. What can I do to stop this? What are there foods that I can eat that can cure GERD? Are there supplements? Are there green foods? Is there something out there that they can do that will help stop their GERD?
There's no food that will cure GERD. GERD is an anatomical issue that Dr. Murray has already described, and that sphincter muscle at the end of the esophagus just relaxes at the inappropriate time. Certain foods can trigger and worsen it. As far as improving it, again, I said milk, but it has to be a low fat milk. Ginger tea would be a good thing to drink. it has been suggested that even higher fiber foods can help. I do think that's a bit of a dilemma because higher fiber foods can often be more difficult to break down and digest, and therefore delay gastric emptying. So what I have found is that there's a lot of individual triggers involved with gastric reflux, and the best thing to do is just find out what your triggers are. And in order to do that, I recommend that you write down for a week what you eat, what time you eat it, and what your particular symptoms were after you eat it. And that'll kind of help you hone in on what your triggers might be.
I love that. Just basically the diary for a week and see. Not ironically, luckily, we actually have an app. It's called the GERD Help app. That allows you to do that. So, and it's free. So you can just download the app and it easily allows you to type in the food and the time that you ate it. And then it also has a symptom tracker. So after the fact, you can just go in there and say, "Ooh, I had really bad heartburn. I had really bad regurgitation." And then you can kind of see what your progression looks like throughout your week. So it's kind of, so we do have that available. If you're watching, we do have a GERD Help app that can do that, but you can also old school write it down on a piece of paper. The last question I have for you is, do patients need to see like a nutritionist or a dietitian for GERD? Do you recommend them to if they have GERD?
There are all kinds of resources out there. Most of the time, your primary care physician has information. GI specialists have information. I personally feel it's beneficial to talk with a dietitian can help to individualize the plan, individualize the foods based on your app, knowing what happens and when they eat certain things, but help individualize a plan for them, including lifestyle changes that might be helpful, and come up with a plan that way. Dietitians are out there and they're willing and ready to help. If you're looking for a dietitian, your healthcare provider can certainly recommend someone for you, refer you to someone, or you can call your local hospital. Usually, if they don't have accessible dietitians for you, they can recommend someone for you, or the health department. You can also go to the Academy of Nutrition and Dietetics website. It's eatright.org/find, and there's lists of professionals that are licensed and registered that can help, and they give you the option of person or telehealth.
Fantastic. Thank you for that. I know everyone watching appreciates that. I do want to ask one question in regards to post-TIF procedure. You are seeing a lot of, for the last 2 years, these patients that have had the TIF procedure. Can you just briefly discuss the diet after the TIF procedure?
We know that it's imperative that the patient be informed of what this is going to entail. They need to be informed and they need to be able to buy into it because it is a process. They've been through so much to get to this point. So asking them to commit to 6 weeks of progressive diet, it's big for some of them, but once you explain the why and the how, pretty much they will go along with it. At Stonecrest, when the patients are scheduled for their pre-admission testing, they're scheduled to see me. So I sit down with them one-on-one, take the book, which I actually copy off and highlight it and color it up, and we go through it in detail. And so we discuss what's expected of them. They don't leave that appointment without their shopping lists, so they know what to buy and have ready on hand for getting through this next 6 weeks. And they also leave with my phone number, so they can contact me before their procedure, and I'm there to help them in the recovery process. Things that I stress at this appointment would be how we will slowly go from liquids to solids, how drinking small amounts, half a cup over 20 to 30 minutes, very tiny little sips, small bites once they get to solid foods, small bites that they chew thoroughly. We want to try to avoid irritating the esophagus to cause spasms. That's a lot of discomfort that they would experience. I tell them we're going to avoid bread and bread products for 6 weeks. We have no tomato or tomato products for 6 weeks. We don't have caffeine for 2 weeks, and no alcohol or carbonated beverages for 6 weeks. So those are some of the big pieces of it.
Fantastic. Thank you. And we do have a question that popped up from one of our viewers. So I'm going to pass it over to Wendy and we'll let her ask that question.
Thanks, Andrea. Vicki, great information. Thank you very, very much. Something that's trendy is, all the diets that are out there, right? And we have Karen asking if a low carb diet is something that you recommend to help her GERD.
It depends on what she's eating to achieve the low carb. Many times that involves extra protein, like very high in meat. Anything that she's for that low carb diet, we need to be low in fat. So if she can achieve that in a low fat manner, that would be huge. And again, eliminating any one big food group can lead to problems down the road. So I would just encourage her to be real careful when she's making her other selections for this diet to try to eliminate the fat component as much as possible.
Yeah.
Good to know. All right. Thank you. All right, Andrea, back to you.
Fantastic. Well, thank you so much, Vicki, for your time today. Like I said, this is our first time having a dietitian nutritionist on here, and I know I'm seeing some comments coming in that they're so excited and happy to have you on. So we really appreciate it, Endogastric Solutions, and thank you and have a happy Thanksgiving. Thank you.
Hey, same to you.
Fantastic. Next up, we will be announcing our second winner for the recipe submission. So we'll be right back.
Hi, I'm Karen, and this is Lynn.
Hi, everybody.
Hi, we're here to announce our second winner of our GERD recipe submission. Our winner is Tatiana Angelos, and she has submitted Totsy's Angean arugula, avocado, and feta turkey burger.
That's a mouthful, Karen.
It sure is, but we're gonna make it today. Okay, so what you're gonna need first is a tablespoon of chopped onion, 1 teaspoon of sea salt, 1/2 teaspoon ground cumin, 1/2 teaspoon ground coriander, and we've already got that all mixed up here in this bowl. You're also gonna need 1/2 cup of crumbled feta cheese, 1 egg white, 4 tablespoons of olive oil, 1/4 teaspoon celery seed, which again is already in this mixture, 1 pound fresh ground turkey, 1 cup of loosely chopped fresh Italian parsley, again is in this mixture, 2 tablespoons Parmesan cheese, 2 medium avocados, and 4 brioche buns.
There you go. All right, so what Totsy does next is she makes a nice arugula salad as a topping for the burgers when they're done. And then we've actually made a little dressing on the side here with some apple cider vinegar and some olive oil that we'll toss in that arugula. But she had a really fun idea, didn't she, when she was making the burgers at the very end? You could actually scoop out the pit from the avocado, scoop this avocado out, put the dressing into the avocado, put it on top of your burger, and then smash the burger down so the avocado drizzles on top of everything. So I thought that would be fun.
I like that.
For our purposes, we just have the avocado and sliced it, so you'll see our finished product here in a minute. But as any burger, you're going to mix all your ingredients together with the exception of the Parmesan cheese. That's going to go on top of the buns that are going to get toasted in an oven with a little bit of olive oil. You want to just toast those till they brown and the cheese melts. And then you're going to make your patties after you mix all your ingredients together. This we have reserved half of the original amount just so we can make 2 patties out of it. So once that's all mixed together, all you're going to need is a frying pan and a spatula. Unless, like Karen said, you want to get adventurous and go out on your grill and cook these up. Either way, it's going to be perfect. So once those buns are toasted and the burgers are done, you want to place the burger on the bottom of the bun. You want to top that with some of the arugula, And again, you want to do your avocado with your dressing inside. And then when you put the lid on top of your burger, you want to smash that down. So it'll be a lot of fun. Karen, do we have a made version of this that we can show everyone? Do you want to take a bite of these?
I do.
Okay, great.
You know what? I'm gonna go ahead and smash mine.
Okay, I like that idea. I'm gonna do the same thing.
Smash it down.
All right, Tatsi, I hope this is the way you make it at home.
All right, I'm
Looks
excited.
delicious.
This looks great.
All right, cheers,
right,
my friend.
cheers.
Great job. All right, everyone, here we go.
It's fabulous.
It's so good.
Congratulations, Tatiana. We're so excited. I actually got to taste this burger when we made it, and it was fantastic. So congratulations. We'll be sending you your prize as well as a cookbook, and you'll see your recipe and your picture in there. I'm going to give away a apron. So if the first person to comment on the comment section that I see on Facebook will get a nice GERD Gourmet apron. So please comment in the comment section and you'll get a free apron in a book, a new cookbook. All right, our next guests that we have today are two TIF patients. You may have seen them before. I know Dylan has been on a couple of things. I'll just introduce him first. Dylan is joining us from Santa Barbara, California, and you may know him from following his story on our social media over the past couple of years. He's on our YouTube, on our Facebook. He suffered from GERD for over 15 years and had the TIF procedure about 2 years ago. And it was a hiatal hernia repair and TIF procedure at UCI with Dr. Ken Chang and Dr. Nin Nguyen. So welcome, Dylan, and thank you for joining us today.
Thanks for having me.
Fantastic. And secondly, we have Kristen Matson. She is joining us from Iron Mountain, Michigan. She suffered from reflux for over 17 years until having the TIF procedure with a hiatal hernia repair with Dr. Fanous in September of 2021. And interestingly enough, all of her siblings, so she's got two other siblings, who also had the TIF procedure. So all three of them had the TIF procedure. So very unique story. Kristen, thank you so much for joining us.
Yes, absolutely. I'm glad to be here.
Thank you. So I'm going to start first with you, Dylan. If some of you haven't or don't know you or don't know your story, can you just tell us a little bit about your story and your experience with GERD and how long you were suffering?
Yeah, interestingly, I started having GERD symptoms when I was about 14 years old. And so I quickly was eating a lot of Tums and taking Zantac and omeprazole. It progressed like that. And then by the time I was like 17, I was taking Zantac and omeprazole daily, and my doctor had recommended or prescribed that. And from age 18 until 29, I was on, maxed out on PPIs, on omeprazole, Prilosec, Zantac for like immediate relief, and always, using Tums. And so, yeah, it's been about 15 years of that. My worst symptoms were like chest pain, coughing, just a burning sensation in my throat continuously for a long time, dry mouth, sore throat. Yeah, I mean, that's kind of it just got worse over the time from when I was 14 years old until 29 when I had the surgery.
Wow, crazy. And Kristen, tell us a little bit about your story. Were you the first one to have the TIF procedure, or did your siblings have it first?
No, I'm not. I was actually the last of the siblings. So my younger brother and sister both had the surgery. My brother went first. And then after we saw that it was a success, my sister went in and got it done, and it was in short succession. I went in right after and saw Dr. Fanous, and it was definitely a quick procedure. Pretty much months afterwards is how it all went down. So
Fantastic.
so
Yeah, and then Dylan, for you, what were kind of your trigger foods for you with GERD?
I mean, in the beginning, it was more limited. It was like the classic, red sauce, anything spicy, marinara type sauce, any red salsa, anything spicy really at all. Deep fried foods, anything citrus, orange juice, anything like that. And then as it got worse, it really got down to the point, honestly, in the last year that I was suffering. Like, it was when it was really bad. It was pretty much almost everything I was eating. Like, I got to the point where I was eating nothing but brown rice and a vegetable or something, because I was just so worried about what the food was going to do to me. So it started with a couple classic trigger foods, and then by the end it was mostly a lot of things that were triggering it to happen.
Oh, crazy. Yeah, I've sometimes heard that people get triggered even by water. So
absolutely,
interesting.
I did for sure.
Yeah.
And there came a point where I couldn't even drink water without having amazing heartburn. And for me, it was not just the fact that I was having heartburn and having the pain. I couldn't swallow my food. I mean, stuff would get stuck in my throat. It kind of became a joke because my family could find me as the one who was coughing to hack up all that stuff in the store. Like, well, there she is. We can hear her. She's over in this corner, and for us, because of all the three siblings, we kind of got together and realized that these are some really bad things that are happening, and we kind of just lived with them and didn't realize what exactly the correlation was until my uncle actually died of esophageal cancer. So that was really the trigger for us when we all realized, hey, wait a minute, these are the symptoms we're having. This is what could happen if we don't take care of it. And so yeah, that was kind of why it spun out of control so quickly.
Yeah, no, thank you for sharing that with us. And I'm so sorry to hear that. I mean, I know Dr. Murray's going to come back on, and that's one of the questions, what can unmanaged GERD lead to? So we'll ask him that question when he pops back on. Dylan, what was it? So that was a trigger for Kristen. What was the trigger for you to kind of finally make that decision? Like, I'm going to go do something about it. I'm going to have the TIF procedure.
Well, I initially, like I said, I was taking the max of medication I could have taken. And I woke up at 3 a.m. one night, and my entire throat was just burning. My throat was really dry too, and the food would get stuck. My chest was hurting. I was coughing. And I had taken my normal dose of medication, and I took Tums, and I took the immediate relief stuff, and then it didn't work, and I just didn't feel right. And so I went to urgent care, and they basically told me I need to get an endoscopy. So then I got an endoscopy, and the doctor who did my endoscopy told me that I was fine and that there was nothing wrong with me, and that I needed to take more Prilosec, although I was already taking 40 milligrams of Prilosec. He suggested that I take 20 more milligrams, 10 in the morning and 10 at night. And I had already elevated my bed. I had already changed my diet. I had already done all these things. And I told him that. And he really, I didn't really get any help. Tried to call that office back. And they, I had no help. And then, so I reached out further because I needed something, what they were giving me wasn't working. And so, I know somebody who works in this field. So they recommended that I go get some diagnostic tests done. And at that point I was desperate, so I was willing to do anything. So
Yeah. Well, and it was interesting, right? It was your first physician that you spoke to that kind of you felt hopeless, and then you went and sought another physician that gave you a different opinion, right? If I remember correctly your story.
Yeah.
And that's when you met with Dr. Chang and Dr. Nguyen, and they said we can help you.
Yeah, Dr. Chang did a full diagnostic, exactly what Dr. Murray was talking about with the Bravo chip, the 48 hours, that whole thing, you know, like a full endoscopy, all those diagnostics. And then immediately after, saw that I had a hiatal hernia, saw that my lower valve was loose, or, you know, and said that I was a candidate, and said that they were going to, you know, that I was a perfect candidate and that it would work, you know, and it did.
Yeah.
So
Fantastic. Yeah.
That happened
And then Chris,
to me
yeah.
as well, actually, and that's why I put it off for so long, because I had gone to a doctor actually when I lived out in Reno for a while there, and they just looked at me and said, pretty much they put me on Protonics. So I was on Protonics for like years, which is, now that I understand, not a very good situation. So I just thought that's what I was dealing with, and I was fine, and there was no big issue until, you know, that happened with my family, and then I just realized the severity of it at that point, and I was glad to find Dr. Fanous for that reason. So
Yeah, fantastic. So how are you feeling today, Kristen, after your TIF procedure?
I feel really, really great. I've lost almost 70 pounds since the procedure. Kept it off, so that's been really nice. I have a lot more energy. I was at a point for a while where I was not eating anything, a few bites of something, and feel full and feel yucky. So one meal would last me 3 days because I would just pick at it. But I was still gaining weight. So, you know, there was things that were because of lack of feeling well and kind of not having the energy to do the things I needed to do. So all that has changed. You know, my energy level, I can eat what I want. I feel good about myself. And, you know, that's, and I actually have really gained a lot of education as far as what I should be eating and the nutritional aspect of it, because it changed my eating habits a lot since that.
Yeah. I love that. I love that. And then how about for you, Dylan? How are you feeling today?
Oh yeah, really the same. I think like one of the biggest things for me is I was so anxious and stressed out every single time I was thinking about what I was going to drink or eat, and it really disrupted the quality of my life. And it's something that people don't take very seriously in the social realm of living. It's kind of just like, oh, you have heartburn. So it's nice to not be stressed and anxious every single day about what I'm going to eat. No symptoms. Like, you know, I haven't taken medication, no crazy symptoms like I had before, no symptoms at all, really. I was able to start like lifting weights again and working out in the gym, which is something I had to stop doing because of, you know, moving up and down and stuff like that. So yeah, just like really the social aspect of living and being able to eat foods and not worry about it, you know, being able to exercise, being able to kind of just live my life as if I didn't have a severe acid reflux problem.
Yeah. Yeah. I mean, I'm laughing, but I'm happy for both of you. And I can't appreciate you guys enough for sharing your story with us. Thank you so much for sharing that with us and being on here and letting other people know that, you know, there's choices. You have choices out there, and be an advocate for yourself. So Kristen and Dylan, thank you for joining us tonight. We really appreciate it. Next up, we're going to announce our third and last winner for the recipe submission, and we'll be right back.
Now it's time for our third and final recipe submission. The winner is Jesse Para from Mission, Texas. We're going to be making his guilt-free, keto-friendly egg custard.
Yummy! All right, what are we gonna do?
So you're gonna need 5 eggs, 12 tablespoons of confectioner's sugar, 3 cups of heavy whipping cream, 4 tablespoons of vanilla extract, and half of a whole nutmeg. But we are gonna substitute with some ground nutmeg that we've got already ready to go. So what tools are we gonna use, Andrea?
So we need some mixing bowls, of course, and then a strainer, and we'll show you how that works. A little whisk and some ramekins or little bowls that you can put into the oven. We will need a little spoon or spatula, and then lastly is our pan that we're gonna put it for water bath, which you'll explain. Yeah.
Okay, excellent. All right, so let's get started. The next thing we're gonna do is preheat the oven to 320 degrees Fahrenheit, which we've got going already.
Yep.
And then we're going to mix the confectioner's sugar with the 3 cups of heavy cream. So I'll get that started. While I'm doing that, Andrea is going to break up 5 eggs into a separate bowl.
5 eggs are going in, and then what are we doing after that?
Okay, after that, we're going to mix this mixture of heavy cream and confectioner's sugar with your eggs.
All right.
Get that whisk. I always make a mess when I'm whisking.
I mean, I'm not a baker, so
We are today.
We are today, folks, and we're very excited about this,
Yes,
Jessie.
we
So
are.
thank
I've got
you.
a sweet tooth, so this is right up my alley.
All right, what are we doing now?
All right, so we've got this mix. Then we're going to pour this in and mix everything together.
Okay. Sounds
I
good.
want to mix it really well to get those clumps out.
You got that? I'll take
Yep.
that.
Thank you.
You're welcome. Okay, so while we're mixing that, after that's done, we're straining it.
Correct.
Okay.
Correct.
All right, here, I'll do that. Why don't you get the strainer ready? So we just whisk this guy up so it's nicely mixed. And then we're gonna go ahead and strain it.
You might need to do this a couple times. It depends. You just want to make sure that the powdered sugar is really fine.
Perfect,
I think
beautiful.
we are all good to go. After that, we'll add the 4 tablespoons of vanilla extract. So I've got my measuring cup right here.
All right, vanilla extract. Pour that in. Okay.
I love the smell of that stuff. All right, we've got that mixed in, then we're gonna strain it one more time.
Okay. So I will hold this and you can strain away. Beautiful. Ooh, this smells so
already,
good,
right?
you guys. I'm so excited. All right. And then is this the last bit of?
Almost, yeah. So once we strain it, we're gonna pour it into these ramekins here.
Okay, let's just
Got that.
say
Thank
that's
you.
done. All right, I can pour away. This actually serves what, 4 people?
4 people,
Okay,
yeah.
perfect. So 4 people exactly. So we're just gonna pour that in nicely. If I spill, I apologize. This is gonna be amazing, y'all, for Thanksgiving. So if you wanna make this.
Yeah, nutmeg is perfect for this time of year.
No, and it'll make your kitchen probably smell so good, right? Okay, so fill these up.
Sprinkle it with a little bit of nutmeg on top. That's almost the last step. Beautiful. Oh, I'm so excited.
All right, and then we cover it, right?
Yeah,
Okay.
cover it. Cover each of them individually with foil, and then set them on your ice bath. Why do we use the ice bath again, Andrea?
So I am no Martha Stewart, but I'm told that the ice bath helps it not burn the bottom of the custard.
Help with that.
I know, well, we won't burn this. And then it also helps cook the custard evenly. So
okay.
that's kind of the reason. So we got that back there, right?
Yes.
So we'll go ahead and grab that. And we'll set it. Let's try not to spill that because, you know, we're kind of clumsy over here. So we pop these here. Ooh, so
Excellent.
excited.
All right, I'm gonna get this in the oven. So you're gonna wanna cook this for 50 minutes in the oven. And then after that, take it out, cool it for about 30 minutes. And ideally, you'll let it sit in your fridge for 24 hours. So be sure to prep these the day before Thanksgiving.
Yes. Okay, so you want to pop that there. And then we've got the finished product. Hold on. Wait till you see what we did. So here's our yummy custard. I know.
Love it.
All right, well, here we go. We're going to give it a try. And let's taste this guy. I'm going to do this one over here. Ooh. Smell good?
Yes.
Oh my gosh.
That is delicious.
Really good, you guys.
Jessie, you're amazing. Thank you so much for this awesome recipe. I hope you guys all try it at home.
Congratulations. I'm super excited to get you. I think it was Jessie. Thank you so much for submitting your guilt-free, keto-friendly egg custard. So congratulations. We'll be sending you your gift card as well as a GERD Gourmet cookbook. Your picture's in there. So thank you again. Next up, we have Dr. Murray back because we saw a ton of questions pop through. So we're gonna do some Q&A with Dr. Murray. Wendy, I am gonna pass it to you to take it away.
Thanks, Andrea. Okay, Dr. Murray, I'm going to fire away. Number one, does GERD ever simply go away on its own?
So GERD can be kind of this up and down of thing. So yes, you can get, we know from the study in Germany, Lebenz did a study where you go into different parts of GERD where you get esophagitis and it kind of goes away, and you can keep going back into that and out of that. So there's times when it gets worse, times when it kind of recedes on its own. That's kind of normal for GERD, and that's kind of like that mid-range reflux disease. Once it's all the time, then it's pretty bad. Then you have to do something other than medications generally.
Thank you. Next up, are there negative health impacts from taking omeprazole and Pepto every day over extended periods of time?
Yes, there are. There's a lot of research in this field now, and then so there's a lot of things. And since we're talking about nutrition, taking these medications will decrease your calcium absorption, is super important in women in terms of as they age, getting frail and breaking bones. It'll decrease your B12, decreases your ability to digest proteins, causes dysbiosis or problems with the bacteria in your GI tract, which we're learning is really important. So these medications alter that. In addition, that the acid in your stomach is there to kill organisms before they get into your GI tract. It's a very good way to kill things like COVID. So if you manage to have your lungs kick the COVID out and you have a bunch of mucus in the back of the throat, you swallow it, goes down your stomach into a vat of acid, kills everything. So it's part of your immune system. So super important. So there's a lot of issues with taking these medications for the long haul.
Very good. Thank you. All right. Lastly, can you talk a little bit about the recovery process for TIF? How much work would need to be missed post-procedure?
It really depends on what you do at work. So usually these operations are really minimally invasive. So there's usually 4 holes if we're going to do a hiatal hernia, none if you get a straight TIF. So in terms of your ability to get back to work, I usually give it 6 weeks, depending on how large the hernia was, right? So a hernia is this opening in your abdominal cavity that allows the stomach to go up into the chest. And that's the main thing. That's the hardest thing to fix, right? So the bigger it is, the more time I want you to give it to heal. So if it's 5-6 centimeters, a big hernia, I'm going to tell people 8 weeks. If we're doing a smaller hernia, I like to get to these things a little bit earlier, 3 centimeters, 4 centimeters, and usually by 6 weeks, you're back to doing everything that you want to do. But if you work at a desk, I have people go back to work after the weekend.
Wow, terrific. Well, on that hernia note, we had one last question come in, and then I'm going to ask you one more. But if a hernia, a hiatal hernia, is left untreated, can it grow bigger?
Yeah, so a hiatal hernia is a true hernia. There's a defect. Unfortunately, it's not in the abdominal wall where you can see it coming out. It's going up into your chest. And hernias do one thing over time, no matter where you get them, you just get larger, and the tissue around them gets worse and worse. So as a surgeon, I don't want to see someone with a 7-8 centimeter hernia when I could have got them when it was 3 or 4 centimeters, right? The tissue's a lot harder to deal with. It's splayed out and it doesn't hold stitches well. And now you have to put mesh in. And so it's way more difficult, and your recurrence rate is going to be higher based on basically how big that hernia is. So yeah, they will get larger over time. Hiatal hernias are the only hernia of the abdominal cavity we treat with throwing medicine at it. So we're seeing a lot of people with really big hernias these days because that's what we've been doing the last 20 years. So the pills will not stop progression of a hiatal hernia. They just won't. It'll keep happening. It'll get larger. And so yes, they will get larger over time.
Great. Thank you very much. Lastly, just to close out this segment before we go to our next, we were talking about this over the break. We were talking about Kristen saying she had been to a doctor previously who said there was nothing that could be done for her. What do you say to those patients out there who are struggling, who are maybe starting to realize, gosh, this isn't normal and maybe I should do something? What's next? What do you recommend?
Extraordinarily common. This is, in my practice, same thing. I see people that, and I stated this earlier, you get on this pathway where no one's working you up for the physiology involved. They take a look at things, and that's not enough. So physiology is how things work. Anatomy is how things look. It's both. You need both of these things to understand reflux. And so if you have to do kind of your own homework, you have to find people that are doing an EGD flip Bravo because they're not all over the place. Most gastroenterology systems, especially around me and other places, you heard the two patients' experiences was very similar. They end up getting on this track where no one does the workup. And so if you're having really bad reflux, if you go to someone that's not doing flips or Bravos, you're not going to get one because they don't have the equipment or the experience doing it. If you have a big hiatal hernia and reflux that's really bad, and you go to a surgeon that doesn't do TIF or doesn't do the newer thing, reflux, you're going to get Nissen. That's what you're going to get. So there's some part of this that the patient has to be able to look for these things, ask, do you do TIF? Why don't you do TIF? Do you do workups, including a pH study and a flip when I'm doing this upper endoscopy? Because if they don't, they're not going to be serious reflux doctors. They're just not. So you have to have all the tools in order to do a good job in this disease.
That's great information. Thank you so much for spending time with us tonight. Appreciate you, Dr. Murray. Andre, I'm going to turn it back to you.
Thank you. Thank you, Wendy. Yes, one last thing for you, Dr. Murray. We heard Kristen talk about her uncle that passed away from esophageal cancer. We don't ever, I think I heard it from you many years ago when I first started working here. We trivialize what GERD really can do and what can happen with GERD. Can you talk about what could happen with untreated GERD kind of in the long run?
Sure. So we know that reflux disease can sometimes cause a change in the lining of the esophagus. Like I said earlier, that's usually a squamous lining. It can change to a glandular lining. And this can happen very rapidly. So a lot of people that end up with esophageal cancer never knew they had bad GERD because that change happened early. It desensitized the esophagus to feeling the acid, and it progressed on to cancer. Esophageal cancer is one of the fastest growing cancers in America, and it's definitely related to reflux disease. It is caused by reflux. And the precursor lesion for that is Barrett's esophagus. So it's really important to know if you have Barrett's esophagus. This is why if you're having reflux over and over again, you should not just ignore it. You should have it evaluated, looked at, biopsied to make sure you don't have Barrett's esophagus. If you have Barrett's esophagus, you'll be followed much more closely. In addition, there's a lot more technology coming out about Barrett's esophagus, so we can kind of place patients into different categories on what their risk factors are and in what their biology looks like in terms of what their risk is to progress on to cancer. So there's a lot of new research in that. If you're 50 years old, you're a male, you're going to get your first colonoscopy, you've had reflux for a long time, you should ask about getting upper endoscopy too, because you want to know if you have Barrett's and you're at risk for esophageal cancer.
Right. Fantastic, Dr. Murray. Thank you so much for all of the great information and also for joining us. And it's always a pleasure to have you on our show. So thank you so much. And before we conclude the evening, we did have a chance to speak with Cecile Rooker. She is the president of the IFFGD, the International Foundation of Gastrointestinal Disorders. She has a long history of working to advance digestive health issues and a deep understanding of the needs of patients and families affected by functional GI motility disorders. Prior to joining IFFGD in 2017, Ms. Rooker was the executive director of the Rome Foundation. So we had a chance to talk with her, and before we see what she had to say, we're going to say bid adieu to Dr. Murray. Thank you so much, and have a fantastic Thanksgiving weekend, or week, if you will. Thank you, Dr. Murray.
So IFFGD is an organization. It's a nonprofit education, advocacy, and research organization for patients that was started 31 years ago by our founders, Nancy and Bill Norton. Nancy suffered from a GI illness herself and started the organization as a way to educate herself and others about GI disorders and to help to build a community and amplify our voices to really reach the needs of the gastrointestinal illness community. GERD affects so many millions of people, and as IFFGD grew through the years, we really wanted to do something to raise awareness about this community in need, the esophageal reflux community, the people that suffered with this day in and day out. So IFFGD went to Washington. We worked with HHS and was able to sponsor GERD Awareness Week on the National Health Observance Calendar. This was 23 years ago. We decided to do this as a community to help amplify our voices and raise awareness about something that most people took for granted and thinking heartburn is just something everyone has. And it might be something that you get from time to time. But if you suffer from it repeatedly, then it's considered GERD, which is a disease. And we wanted to raise awareness about that. So 23 years ago, we worked with HHS, had it put on the Health Observances calendar as the week of Thanksgiving, which of course is a week that most people tend to overindulge and then suffer a lot from these GERD symptoms. IFFGD does pride ourselves in being an education organization, and so we do try to provide resources for people in the GI community. GERD is one of the major disease states that we do cover, and as such, we have a website just for those with GERD. It's called aboutgerd.org. And you can find that online and on your mobile phone. And it has tons of pages of content, over 100 pages of content on symptoms, treatment, diagnosis, living with the disorder, other patient stories, so you can understand that you are not alone. But not just this, through our resources on the website, we also have what we call a resource library. And IFFGD's resource library is a collection of fact sheets or small articles that you can read in 5 to 10 minutes that tell you specific information about GERD. You can find this at our aboutgerd.org website. And if you want information, of course, you can always email us at iffgd@iffgd.org. Being a part of the GI community is all about banding together and doing things together. And so with GERD Awareness Week, there are things that you can do to get involved in this awareness event. So every year, IFFGD goes out to our patient panel and we try to find out what really resonates with the community this year so we can make that the highlight of our GERD Awareness Week campaign. And this year, what we found is a lot of people felt that they had sort of been forgotten, that now that there are over-the-counter medications for GERD, that there's not as much research going on, and that oftentimes themselves, people they love, just go to the store, they pick up something over the counter, and they continue to suffer. So this year, with our GERD Awareness Week campaign, we are talking about GERD is real, talking about the fact that we do suffer from GERD. Some people every single day, multiple times a day, and that this is something that has not been cured with over-the-counter medications or even the prescription medications that are offered today, but that more needs to be done to move that needle forward. And we invite everyone to join us this week and every week throughout the year to raise awareness about GERD and how it affects daily lives of people, and how as a collective unit we can talk about it, we can ensure that people understand what's going on in our lives, and just raise that awareness and let people know that it's not simple heartburn. It is real. It's a real disease, and it's something that collectively, if we work together, we can make a difference. beyond awareness, there's so much more that you can do for yourself. If you suffer from reflux or that backflow of contents from your stomach into your esophagus, and these are things that bother you, you find yourself grabbing that over-the-counter medication all the time, I really do urge you to take it a step further and not just try to raise awareness about it, but do something for yourself. Advocate for yourself by going to your healthcare provider, because so many things have the same symptoms as GERD, but it's not GERD. So you may be suffering from something that there may be something to treat you, and it's not necessarily GERD. Or if you've had these symptoms for a very long time and you still have bouts of GERD, go talk to your healthcare provider about that too, because long-term exposure to acid in your esophagus can lead to long-term problems that you just don't want to deal with. So please, I urge you, not only join us in this campaign to raise awareness about GERD, but take care of yourself too. Go out there, see your healthcare provider, talk to them about your specific symptoms so that they can make sure that you have the best treatment plan for you.
Thank you again, everybody, for joining us this evening for our special GERD Awareness Week TIF Talk. Wendy and I are very excited that you were watching. And for all of those who participated in helping us build our first ever GERD-friendly cookbook, thank you for submitting your recipes. We're very excited about this project. And we will be giving away some cookbooks. So if you're interested, you can just message us on our GERD Help page and let us know that if you'd like a cookbook, and we can mail one to you. We also have them digitally, so we can send you a link so you can download that as well. Wendy, is there any last comments that you want to make before we say goodbye to everyone and wish everyone a happy Thanksgiving?
Well, since November is all about, GERD and giving thanks for those around us, let's make sure that we say thanks to everybody who impacts us so positively every day. Also, these are the folks that are often affected by GERD that we have. They may not have GERD, but they see us suffer. And it's not a good time for any of them. And if nothing else, maybe it's time to go do something for yourself, but also for your loved ones. So wishing everybody a very happy Thanksgiving. See a doctor, make it a priority, make yourself a priority, make your family a priority, and just know that we're here for you with any questions. And thanks.
Perfectly said, Wendy. Thank you so much, everyone, for joining us. We are on every Tuesday night around 5:30ish. So please join us at our next TIF Talk. Until then, have a happy, and enjoyable Thanksgiving, hopefully GERD-free. Have a good one, everyone. Thank you.
Good night.